Thank you for attending today's presentation. Where are all the nurses? 10 key findings impacting the nursing pipeline. Today's session is brought to you by PreCheck, Cisive's healthcare division. For more than 30 years, PreCheck has partnered with healthcare organizations, nursing schools to deliver background screening, drug testing, and immunization solutions that help safeguard both patients and the workforce. Also, please keep in mind that this presentation is intended for informational purposes only. Neither this presentation nor the material presented during the webinar should be construed as legal advice. Thanks again for joining us today. Without further ado, I'm excited to introduce our speakers, Matt, Jaye, and Joe DeSanzo from PreCheck. Matt and Joe, please take it away.
Thanks so much, Antique. Hi, everyone. So glad that you can join us here. Again, I'm Matt Jaye. I'm our SVP of Enterprise Healthcare here at Cisive PreCheck. Joe?
Thanks, Matt. Hi, everyone. My name is Joe DeSanzo. I'm the Executive Vice President of PreCheck, which is Cisive's healthcare division. Before we jump into the meeting, I want to just give a quick overview of who we are, how we got here, just help give some insight into the context into today's conversation. So PreCheck has been a healthcare-specific background screening solutions provider for over 30 years. And we've had an opportunity serving that market very specifically, engaging with a number of different stakeholders in the ecosystem, largely being HR, talent acquisition, doing background checks for employees coming through, and also the academic partners doing background checks on students going to the hospitals for clinical placements. So we've had separate solutions for these two individuals, and we've had a chance to work with a number of thought leaders in both of those silos within the healthcare ecosystem. I've been doing this for about 20 years now, background screening, and this is arguably the hottest topic and the most strategic initiative I've seen within the healthcare industry, and we'll unpack that a little bit here shortly. Here's the catch and what we're fast uncovering. We have HR and talent acquisition working very hard and very fast to get talent in the door. And we have deans working very hard as well. We're looking at the connection between the two in the process. They're wanting to solve the same exact problem. So we're going to go through today where we believe the friction and problems lie. And that problem really is getting folks from classroom to clinic. We don't have enough doctors, right? If you ask anybody, we don't have doctors. We don't have enough nurses. And these challenges are exacerbated by the great COVID resignation, as well as what a lot of are deeming as the silver tsunami, right? Caring for the baby boomers. So we have a deficit plus a surplus for increase in demand. It's a big problem. It's moving fast. It's coming at us fast. So the real question is, where is the breakdown, right? And today we're going to go through our findings from our benchmark report, from classroom to clinic, the hidden gaps delaying the next generation of healthcare workers. And while we go through today, here's the tweetables, if you will. What if while we're obsessing over the number of people in the talent funnel, we're completely ignoring a huge blockage that's stopping them from coming through the other side, right? So go back to what I said earlier. We have willing students on one side, we have desperate hospitals on the other, and we have clinical coordinators working tirelessly to connect them. So what if it's really not about a lack of talent or desire, rather a surplus of friction in the process due to a collapse in the process? So that being said, I'll turn it back over to you, Matt, to go through the agenda, and we'll go through the findings today.
Great. Thanks, Joe. So a big part of what we're going to cover today is this benchmark study that we did. It was over 300 administrators, over 150 students. And kind of the key takeaway that we had from this, or the theme as we walk through today, was we're really seeing what we're referring to as this clinical placement squeeze. And what we're going to dive into is the research findings from our benchmark study, the impacts of this squeeze on program administrators, students, clinical sites alike, the market implication, and how integrated solutions can help to provide a path forward. So, as I mentioned, the overarching theme was that there's this squeeze, and the squeeze is caused in part by clinical placements becoming an operational bottleneck. We'll dive into the numbers a bit more, but this one was pretty staggering to us. 90% of the administrators that were surveyed indicated difficulty securing enough placements. And part of that is leading to delays in onboarding and clearance that are essentially creating this negative domino effect. So what's that mean, right? If you can't secure enough clinical sites, if you have faculty and instructor shortages, if you're dealing with background screening and onboarding delays, all of these things compile and create, larger massive issues. It's not just a simple check the box process. The clinical placement process is a massive undertaking, and it's affecting administrators, students, and clinical sites alike. Yeah. So as we talk about the placement squeeze, we're going to dive into the numbers and really the relationship between the hospitals and their academic partners. We see this essentially as a paradox of two friends sitting down for dinner. Each of them speaks a different language. They both want to enjoy a wonderful meal together, but there's no Rosetta Stone that's connecting the two of them. While that might seem like a far-fetched analogy, as we go through the data, it's really not. You'll see at the top of the list here where the process is breaking according to administrators in the most inefficient areas. 30% reported clinical placements being their primary issue, meaning there's not enough sites, there's not enough preceptors, faculty availability is another issue. Those two in and of themselves are probably no surprise for this audience. But I think as we start to peel apart the layers a little bit more and we look at those next level items, technology and systems, meaning outdated software, systems that don't talk to one another, effective scheduling platforms. These are all leading up to these bottlenecks. I would have bet money leading into this that those probably wouldn't have been the biggest issues, but surprisingly enough, they are. We're seeing a lot of folks reporting antiquated systems, antiquated technologies in place. So where are the specific pain points? As we said, the faculty shortages, securing enough clinical placements, enrollment caps, lack of pipelines for students to full-time employees, and lower graduation rates as we go down the list. We really need to define what these issues are and break them down at a more granular level. So we'll talk next about how the onboarding delays disrupt the campus to clinic pipeline. The overarching theme that we heard from the benchmark study was admins are reporting postponed and missed clinical rotations. Clinical partners then are forced to adjust as a result of that. So let's think about that for a second, right? We have some things that are controllables. We have some things that are not controllables, right? The faculty and staff shortages, those are long-term systemic issues. We'll talk about that a little bit later. But what we really want to dive into are what are the elements that can be fixed and adjusted. A big part of that is the screening and compliance process, and that being fragmented. What we saw from the respondents, and we'll dive into the data here, is many schools are using multiple vendors and platforms to manage things. And as a result, it's creating a lot more manual work for them, including inconsistencies and risks of errors. I want to pause on that last one for a second. When we say risk of errors, this isn't just an administrative issue, it's a patient safety issue. What if a criminal record gets missed? What if there's falsified documentation on immunization? So when we think about this and the complexity of the process, we asked the folks in this research study, how many systems does it take for them to clear a student? And you'll see over 75% are using 2 or more systems. So I think it's pretty easy to see where the breakdown occurs here. Joe, I know you have some insights on this as well.
Yeah, thanks, Matt. This is something really important to unpack. Matt had mentioned something a minute ago. A lot of what we do is around compliance, right? So when we're placing students to these clinical facilities, we have to make sure they're compliant with each facility, right? And there is no single system of record. There is no single clinical rotation software, and there is no continuity across the systems, right? And so what we found is these systems that worked for a point solution maybe 10 years ago, they're not interoperable, right? And the end result of that is a significant manual burden on the two people we're trying to make this very simple on. That's the administrator and the student, right? Should say all three, the clinical placement coordinators as well at the hospitals, right? But so when you just think about fundamentally, over 60% of the market's using a minimum of 2 systems just for the compliance piece, which is the background, the drug screening, and the immunization. Those alone, and the immunization we'll talk about here in a second, it is a very challenging process. We're also dealing with students who are not experts in this space, right? So when you put the burden back on the students and make it confusing to go into multiple systems, that burden actually compounds back to the administrator, right? So this is something, as we think about a solution forward and how we have to solve this, a lot of our issues right now are systemic. It's because we're using multiple systems to try to accomplish the same task. This was really telling to us of how many systems it took, right? Like we see pockets of things, but this is where we lean into as we challenge folks of why are there multiple systems? It's because this system was used for X 10 years ago. This system was used for Y. They were very point solutions, right? And we need to drive interoperability throughout this process. So something we'll talk about more.
Yeah, Joe, I think the key word there's the interoperability. It's not so much using multiple systems as those systems not talking to each other. And, a great example, something that we heard from respondents was rotation management systems as an example, right? Those are commonly used to figure out where the students are going to go and coordinate with the clinical sites. Great systems, but the challenge is other data is not feeding into them. And if that system is viewed as the source of truth, but you're still having to go to 2 or 3 other places, it starts to lose its effectiveness.
Exactly. And I was just that last week, had a chance to talk about this with One Ed Tech, a panel in Philadelphia with educators talking about this exact thing, right? And I don't think I appreciated the magnitude of how much this slows down the program administrators and deans basically handling this process, right? They're becoming the conduits and the experts of technologies that they need to work together. So when we think about all of the duties that these deans, clinical placement, and program coordinators have to deal with, being paper pushers and compliance experts, it's a big challenge, right? Because we cannot get a student on site until they're compliant. Period. End of discussion. That journey to get there, again, it's very challenging, and 2 systems minimum is leading to that.
So I think that's a great segue. The next thing that we'll talk about is some of the frustrations from school administrators' points of view on the current state of the background screening process. Ultimately what's happening is the administrators are there to teach, to educate, get these students out to clinical, but because of the issues with multiple systems, because of the frustrations and the bottlenecks as part of the squeeze, the admins end up becoming gatekeepers. Students are coming to them because things aren't getting cleared in time. These are just an example of some of the things that were shared. And I think this is pretty telling and why there's so much frustration and so much buzz about this. Nearly 30% have reported turnaround time delays. So we thought we'd talk about the domino effect, right? What's that mean? Well, if there's a turnaround time delay, it means there's a chance they may not get to clinical on time. Then that puts the relationship with the clinical partner at risk. It doesn't put the school in the best light. So that was by and large the number one item that we heard from administrators that were surveyed. But then other issues, leaning back to what we just talked about, right? Lack of integration with the clinical placement systems, lack of support and communication. This fourth one's massive, incomplete or missed records. And the translation of that is we missed finding a criminal conviction, and now there's a massive patient safety issue, right? That would be an example of that. Now, down at the bottom was a 5% poor user experience for the student. We'll dive into that in a little bit more detail because, as I mentioned earlier, the survey was 300 administrators, but also 150 students. And I think it's pretty telling to see what we hear from the student side of the fence as well.
Yeah, and these turnaround time delays, again, last week, we spoke specifically about placement rates, right? So we think of the root cause and the impacts. The impacts of these fragmented systems that are causing the turnaround times, that truly is impacting placement rates. And a lot of folks are really starting to talk about that and try to solve it at a very fast pace. So go ahead, Matt, I'm sorry.
No, I think that's a perfect point. And with larger programs, these become even more massive issues because the space is just so limited for students, and any misstep can have some pretty significant impacts, both for the administrators, the students, and the clinical sites.
Yep.
So we talked a little bit about the problems. We talked about what folks are seeing out there. The next thing that we're going to talk about is, what do these folks see as the solution? And by and large, admins reported that they want a vendor who can interpret, they can normalize the clinical site requirements across multiple facilities. That was the number one item. Getting more specific though, faster turnaround times, right? You remember on that last slide, 29%, I believe it was, reported that turnaround times were the issue. So we asked folks, what would improve the process the most for you? Nearly 70% said faster results. No surprise there, right? Faster results is kind of the end of that domino, getting the students off to clinical on time, maintaining the relationship with the clinical partners. But how do we get there, right? What gets us to the faster turnaround times? And a big portion of that is those integrations, right? Schools are using multiple systems, having the interoperability that Joe mentioned earlier to connect with those, being able to support the students better and the faculty so that it's not creating administrative bottlenecks in the process. We won't go through each item one by one. I'll leave this up on screen, but I think it's pretty obvious that these friction points need to be reduced and need to be improved upon. One item in particular that we tend to hear a lot about is immunization tracking. That's more of a living, breathing element than a background check or a drug test that might be a snapshot in time. Joe, I know you had some insights on that. I'll leave it to you if you want to share some there.
Yeah, this one is where I spend the most time with customers and solving and prospects alike. So when we think about turnaround time, you know it, Matt. When we think about background screening, drug screening, and immunization, those are really the components that are required for students to go on site for clinical. Some flavors in between there, but those are the three core components. Then you look at the pathways that the three parties communicate: the student, the academic partner, and the clinical site. That's the clinical rotation software, right? So those, it's very important to understand, background screening partners are not clinical rotation softwares, and clinical rotation software are not background screening partners, right? But the importance is the single source of truth on the background screening side and being able to have the products in seamless workflow. So that's the first part. When we talk about turnaround time delay, the part that I love, administrators and HR and talent acquisition folks are starting to understand the delays. What can we solve upstream to stop these delays? All these delays compound, but again, they're all a result of manual processes waiting for one task to complete so the next can start. And so it really is looking at making sure you have a platform that can facilitate a student experience for those components: the background, drug, the immunization. Again, background and drug, fairly straightforward. They're really not. There's nuances in quality and integrity of data that lead to patient safety. When we think about turnaround time specifically, it really is in the process. These are dynamic in nature. They're not point in time. There's different testing where it's a series, right? So having that data be updated in real time, having the student know what to do and being guided is super important. But then it's the second part that's leading to turnaround time, right? Because the turnaround time is the placement, not just the background screen. And that turnaround time delay to placement is because then having one system that can do all three components is one thing, but having it be able to speak with those other systems of record that the other parties use, that's really how we're going to drive down turnaround time. And when you unpack turnaround time, that's where the pain lies, right? Within the admins, is they are the conduit to 4 different processes to 3 different systems, right? Those are real conversations I have with folks. So it really is important to understand where these lingering turnaround times are coming from and helping understand how we have to solve that, right? But that integration is super important. Having a single source of truth, but then the interoperability, that's what the folks are asking for.
Yeah, I think those are great call outs, Joe. And, I would challenge the audience to think too, what would it mean for you if you could take a process that's taking weeks and cut that down to days? What's that mean for friction with students? What's that mean for the relationship that you have with your clinical partners? So with that, we'll turn the page a little bit. We've focused mostly up to this point on the frustrations and the bottlenecks as seen from an administrator's point of view. Next, we're going to focus on what we heard from the students. What did the folks that we surveyed have to say about how the process is impacting them? And the kind of the net of this was almost all students who had begun clinicals reported challenges in the process. Piggybacking on what Joe said a moment ago, a lot of that has to do with the immunization requirements and the immunization documents. Again, not to get too in the weeds on this, but as I'm sure most of the audience is aware, when students go to clinical, there's a myriad of requirements that they have. And it's not just a one and done, right? If we take something like a hepatitis B series, the second dose has to be within a certain period of time, the third within another period of time. So it allows this flux of a student could be compliant today, not compliant tomorrow. Students are constantly having to update their information and upload it into systems. See a lot of frustration around that, repeated requests for the same documentation over and over. So I think that was the biggest takeaway that we had. However, outside of that, again, we won't go through each item one by one, but you'll see there's a high level of friction point across the board, right? These technical issues with the systems and portals, a lot of that has to do with that lack of interoperability. A lot of this ends up bubbling up again, and that's where the administrators at the schools become the gatekeeper for the student, because the student has nowhere to go for help with these issues. But this is a lot. And when we think about the experience from a student's point of view, the impact of that on the brand of the school, these are all pretty big issues in aggregate that create significant frustration, not just for the students, right? For the clinical sites, for the admins as well.
Yeah, Matt, we connected with one student. I think this is profound. They said, I just want to worry about medicine and my patients, not all this paperwork, right? And it's a very simple statement, but again, I think it's profound of we are asking students to become experts of systems that they've never used. And in addition to that, it is challenging the process and all these moving parts in the documents. It's a very task-intensive process for the students. And then to your point, that pain then feeds into the administrators. But it is, I think we have to step back and look at, we think about it, the students, the clinicians, those are our future talent. That solves this massive healthcare problem we have. And that's been how we've been challenging ourselves and our customers. What are we doing to empower them? Right now, we're giving them a lot of very manual, confusing tasks at a very important time of their career where we want to connect with them. So this was very telling, and that comment was very telling of this process. Well, we understand the logistical challenges. It's just a lot for them, and it's hard. It's very hard to manage. So that's not the experience we want for anybody. So.
Yeah, I would almost put it in terms of, if you were an employer bringing on a new employee, there's so much focus on that onboarding and candidate experience process. Why shouldn't that translate the same way into clinical placement? So we'll talk a little bit more about this. This slide focused in on the challenges specific to clinical placement. The next segment that we dug into a little bit more deeply was the challenges specifically to the background and other screening elements like drug testing, immunization tracking, et cetera. As we talked about at the start of this segment, right, students mentioned difficulty uploading documents was a key area, technical issues with the platform, repeated requests. Again, it's just, it creates this bottleneck, or this squeeze as we're calling it, where they're just not getting through the funnel fast enough. This is most definitely a controllable. Frankly, it was kind of surprising to see the level of response and the level of frustration from students. I think I kind of expected the majority to indicate it was a smoother path, but this is important information for us to know so that we can focus in and work with schools, work with hospitals, figure out ways to improve this process, because ultimately trying to get them through school, trying to get them through clinical, trying to get them into the workplace, and each step of the way where there's friction, we're delaying that progress. So I think a takeaway here is, from the student's perspective, the instructions to them aren't clear. The process itself is disorganized. And when we say disorganized, that's not meant to have shade on clinical sites or facilities in any way. It's really a matter of antiquated systems and processes. Everybody's been working with the best tools that they've thought that they've had, but they're not the best. Students have just been, there's a lack of clarity, right? Our teams talk to schools every day, and this is one of the biggest issues that comes up from the admins that we talk about is, how do we get back to letting students be students? How do we get back to educating? You touched on this earlier, Joe, and it's really about removing these barriers to entry, making the process easier, simplifying the technologies. So if we aggregate what we've heard, and we think about this from both the perspective of the administrators and the students, what are they asking for? Students think using a single platform for all compliance would improve the process and ultimately reduce delays. Admins, likewise, they want less systems, they want more automation, they want a source of truth.
Yeah, we need infrastructure, right? That's as we analyze this, Matt, and what I hear you just say is they're asking for a strong infrastructure to support the process, not go through the process with a ton of tasks. Spot on.
Yeah, obviously, the status quo isn't working. To operate at the scale that these schools need to operate at, the clinical sites need to operate at, the solution is the technology. We'll dive into that in a little bit more detail, going over some of the student desired improvements to the process, as well as administrator desired improvements to the process as well. So single unified platform, by and large, nearly 90% student respondents felt that if that could be done, it would lead to significant improvements for them. Faster approval times, these top 3 items, I mean, these really tell the tale of let's get it done accurately. Let's remove the friction. Let's get the students out to the clinical site faster. All right. Now, as we think about from an administrator point of view, we talked at the beginning of the presentation that there's controllables and there's non-controllables. When we think about the controllables, right, that's the systems and the processes that we talked about, the feedback that we heard from the students and the administrators. We'd be turning a blind eye if we didn't acknowledge there's larger systemic issues out there, right? There's not a flip the switch. There's not a software that's going to resolve for enrollment caps tomorrow or faculty challenges tomorrow. So we do want to share some of the data that came from the survey in regard to that and the impact that administrators feel that has. So you'll see roughly 75% indicated there is an impact to their program because of limited capacity. I don't think that's a surprise to anybody on this call, right? Those are things that take a little while to work out. In addition to that, the inability to get folks in seat and retain clinical instructors, 80% of respondents indicated there's an impact there as well. Now, what I think is interesting, even though these are longer term problems, I do think there are unique ways to go about solving for this, right? Joe, I know coming out of the One Ed Tech conference that you were at last week, this was kind of a hot topic, and I think this has applicability here as well.
100%. And I don't want to get off topic, but this is really cutting edge, and it absolutely is relevant. So a lot of folks are talking about how do we, everybody can have the best resume. There's several hundred folks on this webinar right now. We can all go have a great resume in 10 minutes with AI, right? And so the conversation is how do we cut to the qualified folks that can lead, instruct, and then same thing, qualified candidates to get the job placement. And what everyone's looking at is signals. And signals are coming through digital credentials, right? How do you show empathy, right? You don't take a class and get a pass a test for that, right? But what are signals and what are credentials that we can issue that allow us to move at a faster pace for qualified folks to get into seats sooner? So it's a very large, exciting topic, and a lot of institutions are already implementing it, right? But when we think about the applicability of that into the next phase, right? Digital credentials, why does that matter with placements and solving this classroom to clinic? A lot of what we do, we're able to issue badges as well, right? And so empowering the student through this process, when you think about a background check, there's static and dynamic credentials. Static are the things that don't change. I went to Temple University, hasn't changed in the last several decades, right? My prior employers haven't either. So as we verify these things, both the educators as well as the employers are really looking at digital credentials. So what can we issue as a part of our background check that empowers the student through the clinical process and then employment? So that same concept of digital badging, credentials, to Matt's point, we're not going to solve this problem overnight, right, with the educators. But I think it's really important to share thought leadership on what a lot of folks in the industry are leaning towards on how to drive a more efficient process, right? And I think in the where we're at today with this challenge of efficiency isn't just a nice to have, it's becoming a survival strategy, right? And we're very fast in this journey. So to see educators leaning into digital credentials to solve this much larger systemic problem is really exciting and material, right? This isn't conceptual anymore. This is material. So.
Thanks, Joe. Yeah, excited to dive into this a little bit more. I'm going to jump ahead just slightly, though. I thought this was interesting, right? When we think about the challenges that administrators face, one of the questions that we ask them, do you feel that students are ready once they complete their education at your school? And most admins do feel that they're clinically and academically prepared. But to your point, Joe, they see a need for better recruitment and job matching tools so that they connect students with employers earlier. Now, you touched on the digital credentials, and I think that has applicability in a few different areas, right? Digital credentials can indicate to a school that's looking to recruit faculty and clinical staff and have those signals for who the right folks might be. But there's also applicability here in terms of when a student completes the program, right? We have all these tools that are matching them for clinical rotation. What about taking that a step further and having tools that can help match them for recruitment and job matching as well?
Yeah, man, just to bring that full circle, right? Because again, we get super excited about this topic, and it really is transforming and disrupting what we do. But if we think about what we talked about the last 30 or so minutes, right now, everything is task-centered on both the student as well as the administrator. And we think about badging and digital credentials. When I mentioned earlier, modernizing the infrastructure, this is exactly what we're talking about. So let's put this in practice. Right now, whether it's in immunization or education, verification, whatever it is, students, administrators, they're moving things around into multiple systems manually, manual tasks to go meet compliance. We need to digitize that mess, right? So when we talk about modernizing the infrastructure, that's exactly it. What components, what credentials of a student don't change? And why are we in control of those, right? So that is when we talk about staying student-centered, it's modernizing the infrastructure to do so. And then again, that leads to the interoperability of one system and that system being able to speak with multiple. But it all goes back to these folks are ready, right? That's not the concern. It's the transition support. And that's where we're really focusing on the infrastructure of that transition support.
Just to share with you some of the data behind it, only 3% of the administrators surveyed felt that their students are unprepared. So again, going back to the education process, they're getting well educated. They're leaving understanding how to perform the job. That's not the issue. The issue is getting them where they need to be in the time that they need to be there. So as we think about how to improve upon this process, right? We talked a lot about interoperability, these disparate data points of information all across the board. It really comes down to creating an ecosystem that is conducive to the student, the clinical site, the educators. And the only way to do that is through a unified platform, right? What we mean by that is we talk about a unified platform. That can mean interoperability, right? You use a rotation management system. Maybe it's something like My Clinical Exchange or another on the market. Do you have a vendor that has the ability to directly connect with that system? So you have a central source of truth, right? You can go to that rotation management system. You can look in it. You see where the student's going, but you also see, is their background check clear? Are there any challenges? Is their drug test in good shape? Are their immunizations up to date? And that's really the gap that we see right now. Student Check, our product of PreCheck, really positioned to fill that gap and delivers that single platform. So essentially, regardless of what system you might be using through open APIs, things like that, we have the ability to connect directly into those. Taking it a step further, and what really makes this unique, we talked about administrators' concerns of recruitment, getting folks into jobs after graduation, right? Where I struggle to kind of grasp why things are as bad as they are, it's the technology. But breaking that down a little bit, we have all of these students who are coming into clinical sites for part of their education. yet the pull-through rates of getting those students hired at those sites are poor. Well, why is that? It's a lack of visibility, right? The information isn't making it from one side of the org to the other. The recruiters don't necessarily know who's coming through the facility, what their specialty is, things of that nature. So I think this really touches on what you mentioned earlier, Joe, and some of the conversations you had at the conference last week. But this is really where we view the talent marketplace as being an opportunity to kind of close the loop on that ecosystem and deliver more value to students and help them get employed at these hospital sites later in their education.
Yeah, we can enrich this journey with data from the onset of the journey, right? And I think everything you just said, that's the message, that's the ask, is one platform and enriching the journey along the way. And that is all three personas, if you will. It's the academic partner, it's the student, and it's the clinical placement facility. It's really Rosetta Stone. If we've, you mentioned earlier the dinner example, Matt, it is having the infrastructure to be the translator throughout. And like I said, enrich the process, right? I think that has been the biggest aha for the industry, both educators and employers alike, of solutions the student, the solutions the clinicians. So what are we doing to empower them rather than be reactive and make them go through this meat grinder of a process? So
yeah, I like what you just said, and I think that kind of speaks to this case for having a human-centered platform, right? I think that's the key to it. We've lost the humanity in the process. We've got all these different pieces of technology that operate independently, and it doesn't take into account the human on the other end that has to deal with it. I know there's a lot of text on this slide. What we're going to be doing is we'll be sharing this out after the presentation, along with a copy of the benchmark survey. So this will give you some more information on what Joe and I have been talking about today, some items to take back to your teams. At this time, though, I'm going to turn things over to Antique, and he'll be moderating any questions that have come through. Please feel free to continue to post those in the chat as well, and we'd love to answer them.
All right, we have a few questions here. So we use a system called AceMap. Are you all familiar with this system?
We are, yeah. So AceMap is also a rotation management system. When we talk about rotation management systems, they kind of fall into two camps. We have pre-integrated and then open API. So pre-integrated means there's a pre-built integration. It can be up and running pretty quickly. Open API means we have the ability through our API to integrate with virtually any system. So AceMap would fall into the open API category. It would really just be a matter of putting us in touch with the folks at AceMap, having a conversation, being that you'd be a mutual client, and then getting that integration off the ground. What we've seen in the past is these really aren't very complex, so they can be set up and launched relatively quickly. But happy to connect with you one-on-one offline if it's something you want to dive into more detail on.
You may have the same answer for this one as well. Another one is, you mentioned My Clinical Exchange earlier. Do you integrate with them?
We do, and that's pre-integrated. So we have several mutual clients with My Clinical Exchange up and running already today.
All right, here is another one. Do you work primarily with employers or academic partners?
Yeah, so actually we work with both. On the healthcare side, employers, we actually work with over 60% of the acute healthcare market. The reason I highlight that is when we think about the importance of aligning on standards, chances are we may already be working with a lot of the hospitals where you're sending students to, and working with us allows you to make sure you're matching the same standards that they have. In addition to the hospitals that we work with and the acute care facilities across the country, we also work with thousands of academic programs across the country as well. And those are distinct products that we have: Student Check, Student Market, and then Cisive PreCheck on the employment side. So these have been developed specifically for each of those audiences.
Here's another. You mentioned a little bit about helping students find jobs after graduation. Is that a service that students pay for?
No, so a great question. It's actually completely free of charge to the students. We view it as a value add for them. We want to help them get placed. We want to help the schools that they're working with improve their placement rates as well.
And here is another. So we're starting to hear more about mandates pertaining to clinical rotation systems. Based on your experience with your hospital clients, are you seeing this as a growing trend?
We are. It's actually been a pretty hot topic. We've seen some instances ourselves where we've brought on a school that worked with a different system previously. And in doing some audits, we have caught some pretty concerning items like missed criminal convictions, falsified healthcare records. Unfortunately, with AI, students are starting to get very creative. And if you don't have systems and processes in place, it's pretty easy for that to slip through the cracks. So, that's a big reason that we're starting to see facilities take more notice. They just can't accept the Scouts honor. We did everything you told us to do. It's more of a trust but verify. Mandate may not be the right word either. Maybe it's more of, compelling schools to evaluate their systems and their processes. And I think there's a lot of value that can come to that, especially if there is integration, interoperability. Joe, I know you have a lot of conversations on the employer side when it comes to this. I don't know if you have more that you'd want to add there, though.
Yeah, it really is pulling them through. And I was reading another question through in the chat as well. It's about giving them the visibility to pull through. While we work with both sides, it's creating the conduit to then, right? So we have the supply side, the talent side, and as these students come through, it really is engaging in allowing them to connect through that process.
All right, here's another. CB Bridges is required by our clinical sites. How would this work with them? Simplify the process for the school side. This person is a curriculum coordinator for the school. And do you have access to the C Bridges portal?
Yeah, great question. So again, very similar to AceMap. This would be an API configuration with which bridges would have. It would really just be a matter of connecting our two systems together. And then essentially it's a pretty basic data mapping between the two. So we would be able to feed in information on the background checks and the drug screenings that we do, the immunization information that we do into their portal. It would just require a conversation with the technical teams and kind of an agreement on those standards.
All right, we are going to end it there. Thank you for joining us today. Matt and Joe, I'd like to thank you for being with us and providing us with such an informative and timely presentation. To our attendees, I know we've covered a lot today, so if you have any questions about our student screening solutions, you can scan the QR code on the screen right now and schedule a chat with one of our experts. Thanks again for joining us and have a great rest of your day, everyone.